Let us talk about your diagnostic criteria. So kindly take a picture of this, take a screenshot of this, because this is slightly confusing and you have to read it multiple times to understand this. So there are n number of guidelines and the cutoffs are totally different. Let us discuss first the very easy one, that is what is done by the DIPSI here in India. So very easy. It's you get a pregnant female, even in non-fasting, you give them 75 gram of glucose, and then if blood sugar is more than 140, you label that this is GDM and you start treatment. If that is less than that, it is normal. Very, very simple. Now let us talk about the IAT PSGA. That is the most common thing. And then the WHO and FIGO, all those say same. Here they do what is one step test. The test is to be done in fasting with 75 gram of anhydrous glucose, and you have to check the blood sugar thrice, that is at 0 hour, that is in fasting, 1 hour, 2 hour. So if any of those value is abnormal, one value abnormal will qualify the patient to have GDM, right? And obviously it should be lesser than your overt diabetes. So let us say if 2 hours is more than 200 or even the fasting is more than 126, it is not GDM. So 92, 180, 153 and any one value abnormal, you will label this as GDM. Here the guideline is for two-step test. So first step is with 50 grams of glucose, and then after 2 hours, if the blood sugars are more than 130, 140, then the second step is to be done, and that is not with 75 gram, that is with 100 gram of anhydrous glucose, again in fasting state. And then here you do what is 0, 1, 2, 3, that is 4-point testing, and any two abnormal will qualify the patient as diabetic. So 95, 180, 1. This recommends that either you can go with your one-step test, which I have already described, or you can go like your ACOG two-step test. Both is okay. But usually what we do is one-step test with 75 gram of anhydrous glucose, and the cutoff are 92 at fasting, 1 hour is 180, and 2 hour is 1. Any one abnormal will qualify the patient as GDM.